Well, now to New Hampshire, another big swing state, where a new poll shows Hillary Clinton's lead is narrowing. A new Monmouth University poll puts Clinton at 46%. Donald Trump is 4 points behind at 42%. But it's notable that gap between Clinton and Trump was 9 points in September, and now it is closer. It comes as voters learn more about Obamacare premiums rising sharply next year, which could be a game changer, potentially. Donald Trump's son, Eric, says Obamacare is simply not living up to its billing.
The problem is no one ever holds politicians accountable. You know, Obama promised a couple things. You're going to be able to keep your plan, you're going to be able to keep your doctor, and that the average family was going to save $2,500 a year. The problem is you didn't get to keep your doctor, you didn't get to keep your plan, and the average family spends $4,500 more a year.
Luis Radnofsky is a health policy reporter for the Wall Street Journal, and it's great to have you today, Luis, as we take a look closer at the healthcare issue overall. Based on your reporting and your experience on this subject, how does this play politically for folks? Is it a huge motivator for people politically?
It can be. People's feelings about the health law tend to track pretty closely with their partisan affiliations, how they're feeling about the economy, and how they're feeling about the president. So for both parties, particularly Republicans at the moment, it's certainly a powerful issue to use to rally one's base. With undecided voters, like the country as a whole, people have contradictory views about the health law. They simultaneously don't like it, but they also don't want to repeal it. So for a politician who's appealing to those voters, they have to thread the needle pretty carefully.
A man described as the architect of Obamacare spoke on another network this morning, and he was defending what has been one of the big headlines of the week, which is the raise in premiums that a lot of consumers are going to see. Let's go ahead and just take a listen to his defense.
First of all, 83% of people in the exchanges actually get subsidies, and they're going to be held almost harmless by these increases. They're actually not going to see the increases because their subsidies rise to cover the premiums. The second thing, Joe, is that most people think this is a one-time adjustment because initially the insurance companies miscalculated the premiums, not knowing who was going to come in, and this is going to be an adjustment. But the next president is going to have to make some modifications. God willing, the Congress will go along.
Let's work through a few parts of that, Luis. The first part being that the raising of the premiums are harmless because of subsidies. Walk us through that. Is that true?
So there are about 10 million people right now who get coverage through healthcare.gov or a state equivalent, and of those people, around 80% of them get some sort of subsidy that offsets the cost of their premium. Those subsidies are tied to both their income and the cost of coverage in their area, so if the cost of coverage goes up, the value of their subsidy goes up too. But it's also important to remember there are about 9 million people who don't use healthcare.gov, most of whom are not eligible for subsidies, and another potentially 10 million people who could be getting coverage through healthcare.gov or through an insurer because they don't have access to it any other way. And those people don't get subsidies because their incomes are too high to qualify for them, so they feel the full impact.
So they'll feel the impact. The subsidies, for a moment, who pays for the subsidies?
So the subsidies are federally funded. The Obama administration has pointed out that because premiums came in lower than expected for the first couple of years because insurers took a fairly optimistic and competitive approach to the new markets, there is some money left over for this adjustment year, except that there are a lot of people who don't think that it's going to be an adjustment year or that this is a one-time thing. The risk that they see is that if the rates go higher this year, they will further deter healthy people from signing up, which means that next year the rates can only go further, and the situation becomes self-compounding pretty quickly from there.
And when you say federally funded, I'm assuming that means taxpayer funded, because we fund the government?
That's right.
So even if you're receiving a subsidy, in another way, you could actually be paying for your own subsidy because you're a taxpayer.
Certainly, but again, as I said, the rates did come in lower than expected, so the question is now whether the subsidy has to continue to go up in the future.
And that's one of the games of the new health care law, and I apologize for the use of the game, but that's what we're watching it play out, how it's going to function, because these are moving numbers, and that's something we're seeing from health insurance companies, how they're placing costs, what we're actually paying. We heard Hillary Clinton talked a little bit about deductibles. So I also want to just zero in on whoever is the next president, what that means for this health care law and what modifications would have to be made. I know that's a big topic, Louise, but what do you think is at the top of that list?
So right now on the campaign trail, particularly as candidates talk to their bases, you're hearing a lot of ideas to change the law on fairly extreme polarized sides. People want to repeal it, people want a public option, people want to expand it in other ways. My guess is that when a closely divided Congress is elected, if that's the outcome of this election, regardless of who's in the White House, Republicans and Democrats are going to have to do something about health care they haven't had to do for 7 years. They're going to have to talk to each other. They're going to have to actually negotiate on what changes they could both agree on. And so the kind of changes you might expect there are going to be much more middle-of-the-road ones that can get bipartisan consensus.
One of the arguments in favor of Obamacare, and we've heard it on our own program, so I just want to flesh it out for our viewers a little bit, is the rising cost of health care would be so much worse if we did not have Obamacare. We've heard a few different Democrat surrogates tell us about that. Is that the truth?
It's hard to tell what would have happened without the law, and there are a lot of things that people attribute to the law that are not to do with the law, and a lot of things that are, but in ways that are more complicated than people can perhaps follow, because there's just a lot going on in healthcare. But, I mean, the law has certainly made sweeping changes to the way health insurance is priced and sold in the United States, especially for people who get it on their own. You can get it regardless of your medical history. That's a big change, and so sort of the impact of that change is likely to take years to discern.
And absolutely a fair point. You know, it seems that a lot of our more detailed conversations come back to these central tenets. Well, what about health care costs? What about our debt? What are we really doing to attack some of these problems? And just as we close up here, you know, because we've heard two polarizing potential solutions for health care and where it's going. We've heard from the Democrats at times, or critics of the Democrats, that Obamacare is a setup that eventually will need a public option. We've heard from more conservative voices that what we really need to do is allow competition for health insurance companies across state lines. My question to you today is, could we actually do both? Is there a possible compromise with two of those things to bring them together that could help, which is already an issue that's very much a challenge in our country?
So both idea inflames the other side, and I think what seems more likely than anything else is that next year people will find themselves doing neither. And instead talking about more moderate changes to the health law, the kind of things that are backed by insurers. For example, conservatives would like to see the pricing structure of the health law changed if they can't overturn it, so that younger people are allowed to pay less, and older people in turn can be charged more, in line with what insurers think that they actually, you know, cost in terms of claims. That's a conservative idea. A liberal idea is to expand the value of tax credits. In theory, both sides could could trade on these two things and reach some sort of compromise. But it's very different from the sort of things people are talking about right now, like a public option.
Yeah, of course it is. And we're in a different environment, being before Election Day. Louise, a personal thank you from me. It's so nice to be able to have a substantial conversation on such a big issue during a time when there's so much emotion. So we appreciate your expertise, and we look forward to having you back on the program. Thank you.
Thank you for having me.